welcome to this video where we are describing and explaining Medicare supplements as well as Medicare Advantage plans. Matt's going to go over Medicare supplements and give you everything that he knows about them. And then I will be describing and explaining Medicare Advantage plans. Now, Medicare Advantage plans, of course, we can't go into as much detail because there are a lot of them, while Medicare supplements are standardized.
So is that why you gave me supplements and
That
you took
is
advantage?
correct.
Gotcha. Okay, perfect.
I'm not stupid.
Okay, well, hey, let's get started. So in previous videos, we've talked about Medicare Part A and Medicare Part B. Today, we're going to talk about the supplement versus the Advantage plan. It's important to know that supplements are great for some people and Advantage plans are great for some people. Some agents think, oh, well, I would never sell an Advantage plan. I'd never sell a supplement. And they think one way is the correct way.
Those are what we call bad agents.
Exactly. And truly, honestly, both routes are great routes. It just depends on the needs of your clients and what's best for them.
Yeah, and also don't forget, we're using a Medicare breakdown sheet that we use with our clients. If you guys want that, that's on our website, so be sure and look that up.
For sure. So I'm going to start talking about supplements. So with the supplements, we recommend Plan G. That's the plan that we like to sell the most.
Yep.
With Plan G, it's important to note there's absolutely no network. So they can go to any hospital or doctor in the country that accepts Medicare and do so without being referred. So that's huge. So basically any hospital or doctor that accepts Medicare, the places that don't accept Medicare are typically places that your clients aren't going to go.
Yeah, all hospitals accept Medicare.
Correct.
But like if you have a doctor that uses like a homeopathic doctor, natural doctor, they typically will not take Medicare.
So your clients are going to be good wherever they go. There's also 100% coverage. So they're never going to pay for anything other than their Medicare Part B premium and their Medicare supplement premium. So those are the only two things you're going to pay for. Other than that, they've got 100% coverage anywhere in the country.
As long as it's medically necessary and approved by Medicare.
Correct.
Yeah.
So now there is one thing to note. There is a Part B deductible that they're subject to. We're in 2021. Currently, the Part B deductible is $203 per year. And so basically your client's going to have to meet the $203 deductible. After that deductible has been met, the client's out of pocket no more money, no additional monies for anything that's medically necessary. So for a hip replacement or strep throat, a doctor's visit, they're not going to pay anything once that deductible's been met. So the three important key takeaways: they've got to pay that Part B deductible, which is $203. They've got no network to any hospital or doctor that accepts Medicare in this country. And then they've also got 100% coverage wherever they go. So Medicare supplements are great for anybody that travels. If they travel extensively, not just short little here and there trips, but like clients that may have a second house in Florida or wherever. It's great for somebody like that travels extensively. It's also great for somebody that's got lots of health issues because they're going to be taken care of. So it is guaranteed issue when they're turning 65 or coming off group. So any of those individuals that may have worse health conditions, it's great to start with a Medicare or great to go on a Medicare supplement because they're going to be better taken care of. So if they travel a lot, if they have health issues, and one other thing that I tell people, if they just have money to burn, if money's not an object, then a Medicare supplement is typically the better route. So those three instances, I believe a Medicare supplement is going to be your best. Now, what does a Medicare supplement cost? So obviously a Medicare supplement is going to be more expensive than a Medicare Advantage plan. Dallas will get into that in a minute. But the three things that your clients are going to pay for if they go on to a Medicare supplement are going to be, number one, they've got to pay their Medicare premium. So typically, like Dallas and I have covered prior, the Part A premium typically doesn't cost anything most of the time, but they will have to pay a Part B premium, which in 2021 is $148.50. Typically goes up a few dollars every year, but they'll pay $148.50 for their Medicare Part B premium. They'll also pay their Medicare Plan G premium, their Medicare Supplement premium. And so that premium depends on where you live, how old your clients are, things like that. So every state's got different charges, every area's got different charges. So it just depends on your state, as well as gender and tobacco usage and things like that. And then the final thing is that a Medicare supplement doesn't cover is prescription drugs. So it does great on all the hospital and doctor coverage, but there's no prescription drug coverage. So your clients will want to add a standalone prescription drug plan, which you can do. You have to get AHIP certified. We were just talking about it. You got to get AHIP certified, and to do your due diligence, you go through and add all their drugs, and it'll spit out the best plan for your clients for a prescription drug plan for Part D. So the three things that they pay for on a Medicare supplement is going to be your Part B premium. It's also going to be your Medicare supplement premium, as well as a prescription drug plan. They're going to pay for all three of those items. And if they do that, they're going to have really great coverage that they're going to be able to take to any hospital or doctor in the country and have 100% coverage. So one thing that we like to do is we use this sheet, and this sheet does great. Like Dallas mentioned, this sheet's on the website, but it makes it super easy when you're sitting down talking to a client, because I can write down what their Part B premium is, what their Plan G premium is, their drug plan premium, give them a monthly total so that they know down to the penny what they're going to expect to spend, and that way it also works as a takeaway. So when they leave the office or you leave the home, they've got that information there. So if you have any questions about Medicare supplements, Dallas or I are happy to help. Just call the office. One of us be happy to answer any questions you have. Anything I missed?
No, I don't think so. The only thing I thought of is some people may be wondering, okay, what is medically necessary and what is not medically necessary? If a doctor says it's got to be done, then it's going to be covered by Medicare.
Well, a good example, like plastic surgery, is typically not covered by Medicare because it's not medically necessary. Dallas goes and gets a facelift while he needs it. It's not medically necessary.
I bet I could get a doctor to say it's medically necessary.
You probably could, but an instance when it would be medically necessary is say you're in a house fire or something like that, and you get burned and have severe burns. Then that plastic surgery would be medically necessary. So it just depends on that. That's a great point. So things that are medically necessary.
Nice.
Awesome. Well, I'll kick it to you on the Advantage.
All right. So here's the thing. I always tell my clients, Medicare supplements are for people that want to pay everything up front and then not ever worry about it again. You know, when they go by that doctor's window, they just wave as they go by, because after you reach your 203, you're done, right? And so you don't have to pay any doctor's bills. Medicare Advantage plans, on the other hand, are for people that say, you know what, I'm going to pay less up front, and then if something happens, then I'll pay, because typically
pay as you go, right?
Well, yeah, pay as you go kind of. If you want, if you want to take that route, Medicare Advantage is the way to go. So again, with a Medicare Advantage, you do have to have Medicare Part B. You have to have Medicare A and B. So you're gonna, no matter what you do, you're gonna have to pay that $148.50 for Medicare Part B. Now, with a Medicare Advantage, especially, it's gonna vary by area. They vary by zip codes, by county, and stuff like that. Typically, not always, but typically, there are gonna be Medicare Advantage plans that are zero premium. Okay, so whereas the Medicare Supplement has a premium, a Medicare Advantage plan does not have a premium. This is because Medicare actually, it does have a premium, but Medicare actually pays that premium for you. So for example, if you went with company ABC, Medicare will actually pay company ABC anywhere from $800 to $1,200 a month to take you. And so you do not have to pay any portion of that premium. Some counties, when sometimes we found in a very rural county or something like that, you'll have a $10, $15, $20 premium with an Advantage plan. In that place, you're probably going to go with a supplement anyway.
They're typically much more affordable.
Right, they're more affordable, but yeah. So you're going to have a zero premium. So
one other thing, the reason why Medicare does that is if you enroll in a Medicare Advantage plan, some people call it a replacement plan or whatever, Medicare essentially washes their hands and they're out of it at that point.
Right.
Your benefits are now administered by a private insurance company, and so those companies will administer all your benefits. You'll pay things that Dallas will get into, co-pays and things like that. But that's the reason for the premium is Medicare's kind of out of it at that point.
Yeah. So when you have a Medicare Advantage plan, if that's the route you want to go, you take your Medicare card and you keep it because you're still on Medicare A and B. But I always tell my clients, stick it in the sock drawer because you're never going to use it. Because let's just use company ABC. If you go the Medicare Advantage plan route, then that company ABC is now your primary. It is your secondary. It is everything, okay? So with a Medicare Advantage plan, like we said before, you pay the $148.50, you pay zero premium for your Advantage plan, but then you pay as you go. For example, if you go to your primary care doctor, usually you have a copay of $0. But if you go to a specialist, you have to pay anywhere from $35 to $50. If you go to the ER, you have to pay $90 out of pocket.
These are just average numbers.
If you, and just for a tip, if you say, hey, look, I'm going to show you how to take care of that, you can later plug in a hospital indemnity plan, which we'll talk about in another video. But your emergency room may cost $90 out of pocket. Your ambulance ride may cost $250, $300 out of pocket. If you go and have to enter a hospital and you're admitted to a hospital, you're going to have length of time and cost. So for example, a popular one around here, it's $310 a day for days 1 through 8. $310 a day for days 1 through 8 is going to add up. And you say, okay, but Dallas, there's no premium, but these are going to add up to quite a bit of money after a while. That's why Medicare Advantage plans have a MOOP, a maximum out of pocket. So around here, the typical MOOP is anywhere from $3,400 to $4,500. One of the popular plans around here, the MOOP is $3,900. So every time you spend something, if you go to a specialist and it's $35, that goes towards that MOOP. If you go to ride in an ambulance and the cost is $150, that goes towards that MOOP. If you go to the ER and it's $90, that goes towards that MOOP. Once that MOOP is hit, once you hit the amount of $3,900, it doesn't matter what happens the remainder of the calendar year, you are going to pay no more out of pocket.
Quick question: what about like drug plans, or excuse me, like drug copays, and I think there's extra benefits on there like dental and stuff. What is that money? Does that go towards my?
Those do not. So your drug cost out of pocket does not go towards it. And then if you have any drug costs towards anything extra like dental, vision, hearing, anything like that, it's not going to go towards the MOOP.
Perfect.
But anything doctor or hospital related is going towards that MOOP, and once you're done, you're done. Okay? So it's important when you're sitting there. So let's say you've got a client that is 75 years old and they're paying a ton of money. Let's say they're paying $400 a month for a Plan F. Well, $400 a month times 12, that's $4,800. It makes sense for them to go over to an Advantage plan because their max out of pocket there is going to be $3,900 or $3,500 or whatever. So always look at that and kind of, that's why we use this sheet. On the front, we say, okay, here's your maximum out of pocket. Here's what you're going to pay out of pocket if you go with a supplement. Here's what you're going to pay out of pocket if you go with an Advantage plan. So the Advantage plan has the MOOP. It also then, though, comes with dental. Most plans, you're going to get a cleaning, an exam a couple times a year, and then you're going to get an amount that you're allowed to spend on dental. It's going to kind of come with vision. Same thing, you're going to get a free exam and then so much to spend on glasses or lenses, stuff like that. It comes with a gym membership. It's going to come with over-the-counter. They're going to get a booklet that they can shop out of that has everything that you would see in a pharmacy. You can get over the counter. They can order that and have it shipped to their house. Some of them even come with a card. You can go to Walmart or CVS or something like that, and you can purchase those things. Dental, vision, hearing, gym membership. Chiropractic care is sometimes covered. Acupuncture can be covered. Just a lot of different things. Get to know your individual plans. You're going to have a summary of benefits. It's a booklet. Go through that sucker and get to know it like the back of your hand.
That helped me the most when I first got started, was memorizing the plans and knowing those plans. We actually make a little spreadsheet every single year and really get to know the plans. But knowing the plans is a great tip.
Yeah, and that's going to set you apart from other insurance agents. Knowing what, and that way, when a client calls in and says, "Hey,
makes you look more professional."
Yeah, I have ABC company. Okay, they offer $1,000 for dental. You know, so when you're sitting down with a client, you're going to show them all the cost. Here's what it's going to cost, and then you can add them and say, okay, this is your MOOP, and then you can compare supplement and Advantage plan. Now, the positives, as Matt said, to a supplement are you can go anywhere in the country. There's no network. If you want to go to the Cancer Centers of America, Mayo Clinic, wherever it may be,
MD
Anderson, you walk in, you slap down your Medicare card, your supplement card, and you're good to go. You pay at the 203 and you're done. On an Advantage plan, one of the biggest negatives is you have to stay in network. Now, when you sit down with your client, you are going to want to ask them, okay, who's your primary doctor? Who's your specialist? What hospital do you like to go to? All these different things, and then take the due diligence time to look them up and make sure they're in network.
Same thing with their prescription drugs.
Yep, prescription drugs, yeah. And Medicare Advantage plans, of course, have prescription drug coverage in them.
I think you made a good point. As long as you do your due diligence, you're looking up doctors, looking up specialists, hospitals, drugs, all that stuff, you're going to do a great job and a great service for your clients. It's the agents that don't do the due diligence that hurt their clients. One other thing that's important to remember, those plans change every year. And so those benefits change. Like Dallas mentioned, they change county to county, but the plans change. Premiums go up, deductibles, max out of pockets, copays, all those things change. And so it's important to sit down with those clients that are on. It's important to sit down with both clients, the Advantage client, because their plan changed and their copays may have gone up, their deductibles, max out pockets. Maybe you can put them on a better plan, maybe whatever. Same thing on the supplement clients. You need to sit down with those clients and review their prescription drug plans every single year.
October 15th through December 7th, you shouldn't see your family.
Exactly.
Don't tell them I said that, but honestly, you should be sitting down with them, because if you don't, somebody else will. Yeah. And it's probably going to be me. But we can, no, but now, one more thing. because we hear all the time, okay, I want to stay on my network, but I want to travel. I love the Advantage plan, but I don't like the network thing. If they're ever if it's due to an emergency, so if they have an emergency, they can walk into any ER, any urgent care in the country, and they're covered just like they're sitting in their hometown. Okay,
all the copays still apply.
Yeah,
everything.
And even if they're admitted in the hospital, it still applies to as if they're sitting, for our example, Springfield, Missouri.
They've got to go through the proper channel. That's important.
ER and urgent care.
If they don't do that, your client will be stuck with bills that they're not expecting. So
Yeah.
it can't be your son's friend's neighbor's doctor. It's got to be, the emergency room. As long as they use the proper channel, they'll be taken care of.
Here's the thing. Let me wrap it up like this. Don't be afraid of one or the other, right?
Correct.
Don't be the Medicare supplement guy. Don't be the Advantage guy. Sit down. Your job is not to sell, especially in the Medicare field. Do not sell. Sit down, educate your client, and then let them pick which one they want.
Mm-hmm.
For a couple reasons. One, if they don't like it, it's on them. And I'm not trying to be mean, but if you push them towards a supplement and they hate it, guess who they're going to call and complain about their supplement? You.
They're going to be at the senior center and complain about how much money they're paying, and I'm not paying anything, and now some other agent's taking my business.
Again, it's going to be me. But make sure that you simply just educate your client and then let them pick what's best for them. Right?